Hello everyone, welcome to day 10 of genetics. Today we are going to discuss some of the lysosomal storage disorders and some of the sphingolipidosis. Out of that, the most important one, the commonly asked question is Tay-Sachs disease. Remember, Tay-Sachs disease is one among the many other disorders which comes under a broad category called as GM2 Ganglosidosis. Remember children, GM2 Ganglosidosis are a group of 3 lysosomal storage disorders, which is caused by the deficiency of an enzyme called beta hexosaminidase. So Tay-Sachs is one among the 3 of the storage disorders which is caused by the deficiency of beta hexosaminidase. Remember, this enzyme beta hexosaminidase is having 2 subunits. One is two isoenzyme. One is hexosaminidase A and another one is hexosaminidase B. This hexosaminidase A in turn have 2 subunits, alpha and beta, whereas hexosaminidase B is predominantly beta. Yes. So there are 3 different genes which encode for this. Yes. One is called hexa, another one is hex B, and another one is both hex A and hex B. That means I told you, right? Beta hexosaminidase have 2 isoenzymes, hexosaminidase A, hexosaminidase B. Hexosaminidase A have alpha beta subunit. So hexosaminidase hexa means hexosaminidase A alpha subunit is coded by chromosome number 15, whereas hexosaminidase A beta subunit is coded by chromosome number 5, and another one is what we call it as GM2A, that means which has both of this, that is coded by again chromosome number 5. Remember, chromosome number 15 is for hex A, hex B is chromosome number 5, again that is GM2A is also chromosome number 5. So what is the problem in Tay-Sachs disease? I am going to specify this very clearly because this is one of the most this is the point where most of the students have confusion. Actually, what is the problem in Tay-Sachs? So remember children, Tay-Sachs disease is a GM2 ganglosidosis. So what is the normal problem in GM2 ganglosidosis? Beta hexosaminidase. That is the problem. And remember, this beta hexosaminidase have 2 isoforms, hex A and hex B. Out of that, in Tay-Sachs disease, the mutation is alpha subunit of hexosaminidase A, which is nothing else but an isoenzyme of beta hexosaminidase. So if they ask you in a multiple choice question, which of the following is the defect present in Tay-Sachs disease? Option A, beta hexosaminidase. Yes, right. Option B, alpha subunit of hexosaminidase A. Again, it is right. And option C, both A and B. Yes, that is the correct answer. And option D, they will give you a beta subunit of hexosaminidase A. No, that is not the wrong answer. Sometimes they will give another wrong option. The defect is present in chromosome number 15. Yes, because alpha subunit of hexosaminidase A, which is an isoenzyme of beta hexosaminidase, is located on chromosome number 15. True. Fine. Remember, the clinical history will be that of a juice. In juice, these are more common. Fine. So again, this is misfolded proteins which will undergo accumulation, and remember these proteins will crosses the blood-brain barrier, so it has lot of CNS manifestations. Now let us go for the morphology. I told you what is the problem here, alpha subunit of hexosaminidase A. Yes, the most important dominant clinical features are involvement of neurons. And next one is called as retina. What is that? Retina. In retina, it will produce something called as a cherry red spot in the macula. In the retina, we have optic disc and macula. And remember, a cherry red spot is present in the macula. They will give a picture of retina in which there will be a reddish spot at the region of macula, which that means what usually the macular will be pinkish to reddish in color, whereas in case of this, because of this accumulation of this misfolded proteins, what will happen, the new retinal ganglionic cells will undergo swelling, it will undergo edematous, and finally it will produce a pallor, that is what we call as a cherry red spot in the macula. Fine. And this is a characteristic feature of Tay-Sachs disease. And of course we will have cytoplasmic inclusions, and these cytoplasmic inclusions, it will be arranged in the form of like a skin or the layers of an onion, and that is what we called as onion skin layer membrane. What is that? Onion skin layer membrane. So these are the 3 important points, and on histology there will be ballooning of neurons. Ballooning, the neurons will undergo ballooning, as you can see here. See, these are ballooning of neuron, and these are in electron microscopy. You can see what is that? Onion skin layer appearance. So these are the important points you have to remember in Tay-Sachs. Just remember the salient features to solve the MCQs. Fine. Okay, see, cherry red spot almost occurs in almost all patients. Fine, yes. And antenatal diagnosis can be made by DNA based analysis as well as enzyme assay. There will be lot of CNS manifestations, that is, what are they? Motor, mental deterioration, then intellectual disability, muscular flaccidity, blindness, increasing dementia, everything. And remember, cherry red spot, no, in the macula, it is present in almost all patients. The next variety is what we call it as the Niemann-Pick disease. In Niemann-Pick disease, we have type A is there, type B is there, and type C. Type A and type B have almost overlapping features, but still we are going to discuss in bit detail. So here the problem is sphingomyelinase enzyme is deficient. Okay, inherited deficiency of sphingomyelinase. Remember, it is an autosomal recessive condition. Okay, I'm going to write here, it is an AR. That means autosomal recessive condition. And we have type A and type B. Remember, type A. Okay, I'm going to stress it. Type A is a severe infantile form. Type A is a severe form. Why we call it as type A is a severe form? Because there will be what extensive neurological involvement. There will be progressive wasting, and remember, within 3 years of life there will be death. Whereas in type B, it is a very less severe. It's a almost a mild form, I can say. Okay, because there is no central nervous involvement. And remember, type A is an infantile form, whereas type B. Okay, I'm writing here. Type B is nothing else but an adult form. Okay, type B is nothing else but an adult form. And again, this is also most common in Ashnaki's juice. Okay, yeah. And they may ask this question: what is the chromosomal defect? Because in Niemann-Pick disease and all, we won't remember the chromosome, but I want you to remember the chromosome because it is mentioned in Robbins. The gene for acid sphingomyelinase, it is located in chromosome 11. Okay, just remember it. Okay, don't remember 11p 15.4. Don't like that. Okay, but it is chromosome number 11. And remember, chromosome number 11, and what it has been. Not only, even though it is an autosomal recessive condition, we have another concept in genetics that is called gonadal, what we call as imprinting. That means we have maternal and paternal alleles. So in gonadal or genomic imprinting, what will happen? One allele will be deleted and another allele will be silenced. Okay, so that we will discuss in soon. We have two syndromes, that is Prader-Willi syndrome and Angelman syndrome. So of course, in Niemann-Pick disease, and so it has been proposed that genomic imprinting has played a very major role. So this comes in questions like this. In multiple option answer type question, they will ask you, in which of the following conditions genomic imprinting has been postulated? So number one, Prader-Willi syndrome. Number two, Angelman syndrome. Of course, both are the classical example which has been mentioned in Robbins. But the third option they may give is Niemann-Pick disease type A and type B. Remember, in that also it has been found out. What is the chromosome? Chromosome number 11. Fine? Yes. Okay, once this is done, let us go for the morphology. Okay, let us go for the morphology. Yes, so in type A, I have told you what is it? It is an infantile type of variant. So there will be progressive accumulation of the sphingomyelin. Okay, and here also there will be distension of lysosomes because of the sphingomyelin and cholesterol. Okay, and electron microscopy, and this is the most important characteristic feature. Electron microscopy will shows like this. Okay, electron microscopy will show something like this. Okay, what is this? These are called as zebra bodies. Okay, there will be some membranous cytoplasmic bodies which concentric lamellated myelin figures, and these are sometimes called as zebra bodies. So in onion skin appearance in Tay-Sachs disease, and that is also an electron microscopic finding. And whenever what we come across the name called zebra bodies, remember Niemann-Pick disease. Okay, Niemann-Pick disease, and there will be massive splenomegaly, and there will be, again, because I told in type A or the severe infantile form, there will be dominant CNS involvement. So there will be vacuolation and ballooning of the neurons. And another important thing, as in Tay-Sachs disease, because of this vacuolation or because of the swelling of the retinal ganglion cell, there will be cherry red spot in macula. But remember, it is present only in 1/3 to 1/2. Whereas in Tay-Sachs disease, almost all patients have cherry red spot macula. So remember, hepatosplenomegaly, a child with hepatosplenomegaly. Okay, that is a 6-month-old child coming with hepatosplenomegaly, failure to thrive, generalized lymphadenopathy, then severe psychomotor dysfunction. Okay, all these you have to go for the answers. Niemann-Pick disease, enzyme deficiency, sphingomyelinase, chromosome number 11, autosomal recessive, genomic imprinting has a major role, ballooning and vacuolation of the neuron, retinal cherry red spot in macula, severe hepatosplenomegaly, zebra bodies, sphingomyelinase enzyme deficiency. So these are the important points you have to remember. Okay, see, this is the hepatocytes. Okay, you can see the formy vacuolated. So I told you, this can hepatosplenomegaly. So in liver, what happens? This sphingomyelin get accumulated, and all these will form a formy vacuolated appearance within the hepatocytes and the Kupffer cells, and which will give what we call it as a vacuolated formy appearance. Okay, you can see in this picture, these are vacuolated formy appearances. Okay, vacuolated foamy appearance. Okay, yes. And next is what we call as Niemann-Pick disease type C. Okay, this is type C because in type C we have two distinct type of mutation. One is NPC1 and NPC2. And remember, this NPC1 and NPC2 is responsible for cholesterol transport. Okay, this is responsible for what? Cholesterol transport. Okay, yes. That is NPC1 is membrane bound, whereas NPC2 is soluble. Both are involved in the transport of free cholesterol from the lysosomes to the cytoplasm. So when this is defective, what will happen? There will be excessive accumulation of cholesterol within the lysosomes because these cannot be transported into the cytoplasm. Again, the patient will have hydros fetalis, that is within in uterine death. Okay, will happen. There will be progressive neurological damage, ataxia, supranuclear Leigh palsy, muscle wasting, psychomotor regression, all this. But remember, just important thing, NPC1, NPC2, what is their role? That is, they helps in transport of free cholesterol from the lysosomes to the cytoplasm. Okay, then we have something what we call as the Gauchers disease. Again, Gauchers disease, the enzyme deficiency is glucocerebrosidase. I am stressing it is glucocerebrosidase, not galactocerebrosidase. Okay, again it is an autosomal recessive, and the question here is what is the most common lysosomal storage disorder? Answer is Gauchers disease is the most common what we call it as lysosomal storage disorder. Okay, yes. Fine. So there are three clinical types, that is type 1, type 2 and type 3. Okay, the type 1 is called as the non-neuronopathic form. Non-neuronopathic form, that means there will be no CNS involvement, only splenic and skeletal involvements will be more and there will be, and the patients will have more lifespan. Whereas the type 2 is the infantile form. Type 2 is the infantile form or the neuronopathic form because there will be what? Predominantly central nervous system involvement. And third type is intermediate between these two, which has characteristics of both type 1 and type 2. And coming into the Gauchers disease, you know that we have something what we call as Gaucher cells. Okay, we have something called as Gaucher cells. They are nothing else but the phagocytic cells which have what? Swallowed, which has engulfed these accumulated glucocerebrosides and which are found in the spleen, liver, bone marrow, thymus and Peyer's patches. Okay, that they are called as Gaucher cells. Okay, we have some other entity, we call it as pseudo-Gaucher cells. Pseudo-Gaucher cells, and we have something called as Gaucher cells. Gaucher cell is seen in Gauchers disease. I am writing here, Gaucher cell is seen in Gauchers disease. Okay, Gauchers disease. Gaucher cell is seen in Gauchers disease. Remember, they are PAS positive, oil red O positive, and pearl stain positive. Whereas pseudo-Gaucher cells are seen in chronic myeloid leukemia. They are PAS negative. Okay, this is how you have to differentiate between. Okay, this is how we have to differentiate between Gaucher cells and this is how we have to differentiate between Gaucher cells and pseudo-Gaucher cells. Okay, fine. Yes, this is how we have to differentiate between Gaucher cells and pseudo-Gaucher cells. 1 second. Yes. Gaucher cells and pseudo-Gaucher cells. Okay, they may ask this question. Okay, what are pseudo-Gaucher cells and what are Gaucher cells? I am repeating, pseudo-Gaucher cells are present in CML, they are PAS negative, whereas Gaucher cells are seen in Gauchers disease, PAS positive, oil red positive and pearl stain positive. Fine. And remember, this Gaucher cells, see, I told you straight away, what I mentioned in Robbins only I am telling, they are PAS positive Gaucher cells. Fine. Yes, they have eccentrically placed nucleus and on electron microscopy, okay, and yeah, and what is this appearance called as? Okay, this appearance is what we call as you can see here, no, they have an eccentrically placed nucleus and all, and this is what we call as a crumpled tissue paper. Okay, these Gaucher cells, they have a fibrillary type of cytoplasm. See, this is the fibrillary. Okay, these are what we call as a fibrillary type of cytoplasm, and this is what we call as crumpled or wrinkled tissue paper appearance. Crumpled or wrinkled tissue paper appearance. This is seen in Gaucher cells. They are PAS positive. Pseudo-Gaucher cells are seen in chronic myeloid leukemia. They are PAS negative. Okay, you can see here eccentric nucleus, eccentrically placed nucleus. Okay, all these are very important point. Accumulation of glucocerebroside. Okay, yes. Then, of course, massive splenomegaly, say up to some 10 kilogram. Okay, there will be bony erosions. And in type 2, that is the neuronopathic forms, or the in which there will be a Gaucher cells seen in the Virchow-Robin spaces. Okay, there will be neuronal swelling, everything is also present here. And remember, the mutation of the glucocerebrosidase gene is the most common genetic risk factor for Parkinson's disease, and this has been asked in AIMS few years back. Okay, which of the following is the risk factor in that? Okay, for Alzheimer's disease, out of that, the glucocerebrosidase gene mutation is also has been mentioned in this. Okay, yes. So why? Because there is a reciprocal relationship between the level of this glucocerebrosidase enzyme and aggregation of an alpha-synuclein in Alzheimer's disease. Okay, this alpha-synuclein protein has been involved in the pathogenesis of the Parkinson's disease. Fine. Yes. Then type 1, there will be thrombocytopenia, there will be pancytopenia, hypersplenism. I told you, massive splenomegaly up to some 1 kilogram, bony erosions. Okay, bone involvement will be present. Fine. Yes. In type 2 and 3, there will be central nervous involvement. That is what we call it as central nervous system involvement, that is motor neurons and central nervous system dysfunction, convulsions, progressive mental retardation, all those will be present. And another most important thing, of course, by what genetic testing, enzyme testing, we can find these diseases before the birth of the child. Okay, yes. Next, a word about the mucopolysaccharidosis. As far as the mucopolysaccharidosis is concerned, just one important thing: Hunter syndrome and Hurler syndrome. Usually, all mucopolysaccharidosis are autosomal recessive, but the Hunter syndrome is what? X-linked recessive. It is X-linked recessive. Then just tell about the enzyme deficiency. In Hurler syndrome, it is alpha-L iduronidase is the enzyme deficiency, whereas in case of Hunter syndrome, it is iduronate sulfatase. Iduronate sulfatase is an enzyme deficient. Okay, iduronate sulfatase is the enzyme which is deficient in case of what? Our Hunter syndrome. Hunter is always different. Okay, Hunters. So remember, Hunter is X-linked recessive and it is iduronate sulfatase. Iduronidase is Hurler. Okay, Hunter is dominant, long. So remember, long name. What is the long name of the enzyme? Iduronate sulfatase. Okay, yes. All others are autosomal recessive except these two things. Okay, there will be accumulation of mucopolysaccharides, and there will be what? Corneal clouding, facial fractures, joint stiffness, intellectual disability, and there will be ballooning of the neurons. Okay, they are again PAS positive materials will be present. Okay, because they are mucopolysaccharides. Okay, and then hepatosplenomegaly, valvular lesions, subendothelial arterial deposits. Okay, all this not that much specific. That's why I'm not going to focus much on that. Just remember, Hurler and Hunter. Hunter is X-linked recessive. Iduronate sulfatase is enzyme deficiency. Rest all mucopolysaccharides are autosomal recessive except these two conditions. Okay, fine. So hope we have discussed. These are the important things. Remember, Tay-Sachs, Niemann-Pick's, Gauchers. Okay, the types, everything. The chromosomes, everything, these and all in detail you should know, because in postgraduate entrance exam these are the topics that they are more focusing, especially the Tay-Sachs disease chromosomes, Niemann-Pick's chromosome level. It has a genomic imprinting role. Then glucocerebrosidase enzyme deficiency is one of the most important risk factor for the aggregation of alpha-synuclein, which is one of the most important protein involved in the pathogenesis of our Parkinson's disease. Okay, all these points we have to remember. Okay, and remember how to differentiate between pseudo Gaucher cells and Gaucher cells. Okay, pseudo Gaucher cells is present in case of CML, they are PAS negative, and Gaucher cells are present in Gauchers disease. Okay, Gauchers disease, I will write one more point here. What is this? Crumpled tissue paper appearance. Okay, crumpled tissue paper appearance. Okay, yes. So these are the important points you have to remember. So hope you have enjoyed this session. Okay, so we will continue our next session with some other miscellaneous glycogen storage disorders. Okay, and then we will go for karyotyping and other chromosomal disorders. Okay, fine. Thank you.